Mr. Edward Chia.
Mr. Speaker, sir, as we've shared in our replies to members Ms. Herting-Rue and Mr. Lewis's questions on migrant workers' mental well-being earlier, the Manpower Ministry is committed to supporting the mental well-being of our migrant workers, and we are sparing no efforts to strengthen the mental health support ecosystem for them. Since last November, when we initiated the Project Dawn Task Force, Dawn has worked with our NGOs, our non-governmental organizations, partners, healthcare partners, employers, and dormitory operators to develop such an ecosystem to look out for migrant workers, to listen to their concerns, to identify those who need more support, as well as link them with the appropriate care channels. First, we are raising the awareness of mental health issues, and we are broadening the outreach of training in basic mental health and psychological first aid, or PFA. Second, we are working with our NGO partners to make counseling and para-counseling more accessible. Third, mental health care has been made even more accessible. Any migrant worker identified to have need or to benefit from mental health care will be linked up with the appropriate services, including the counseling hotlines. In particular, an escalation pathway with the Institute of Mental Health has been developed to ensure timely care for more severe cases when necessary. Between January and September 2021, 98 work permit holders were admitted to IMH, Institute of Mental Health. Now, this was lower as compared to the same period in 2020, but was higher as compared to 2019 during the pre-COVID times or era. An earlier study, which was conducted by Yale NUS on migrant workers' mental health from June to October 2020, showed no notable difference in stress, anxiety, and depression levels amongst locals and migrant workers, although there were indications of higher levels of stress amongst migrant workers with movement restrictions. Nonetheless, any easing of movement restrictions will need to be done in a careful and calibrated manner, so as not to trade one stress for another. In particular, as you have heard from SMS Janil's speech yesterday, ministerial statement yesterday about our healthcare system. So we have to be mindful that we do not trade the stress of one where there's some restriction of movement for our migrant workers to overwhelming that of our healthcare system. Now, since August last year, we have allowed dormitory residents to visit recreation centers, or our RCs. We recently increased the frequency of the RC visits to thrice or 3 times a week, up from once a week. We have also removed pre-visit testing requirements for vaccinated migrant workers, which benefits more than 98% of the dormitory population. Concurrently, we are working with RC operators and community partners to introduce programs and new offerings to make the RC visits more engaging. We've also recently expanded community visits from 500 to 3,000 vaccinated migrant workers per week. And we have expanded to include Geylang Serai or Joo Chiat in addition to Little India. We've also extended the visit duration to 8 hours at each time. Members of the House, we remain committed towards caring for our migrant workers' mental well-being through a good support system, as well as to continue to ease measures safely. MOM will continue to monitor the mental health of migrant workers by working closely with our partners. Thank you.
Mr. Witcher.
Thank you, Speaker. I'd like to ask the Minister one supplementary question with regards to training. I think the Minister mentioned that we'll be ramping up psychological first aid training. Specifically, is this peer support training for migrant workers to provide support for each other, or is this support for employers to provide a more supportive workplace environment in terms of mental wellness, or is it both? Thank you.
I thank Mr. Edward Chia for his supplementary question. Indeed, we approach this training on a very holistic manner because mental health awareness, the ability to be able to identify, the ability to be able to escalate very quickly and to do constant surveillance and constant monitoring and engagement is a multidisciplinary, multi-pronged approach that's needed by the support of dorm operators, by our FAST ambassadors on the ground, by the employers, by the NGOs, the partners, and of course, ultimately the tertiary healthcare providers, including that of the Institute of Mental Health. So we have a multi-pronged approach. When we started the DAWN initiative last year, DAWN is an acronym. D stands for depression, A stands for awareness, W, wellness. And at the end of the end itself, not at the end itself stands for normalization. How do we help the migrant worker normalize back? And this DAWN task force started with 7 core initiatives. And they are grouped according to primary prevention, secondary intervention, and then the third part, not really tertiary, but where we help them to rehabilitate them back into society. So as a result of that, we've got buddies. We have also worked with volunteers. They become the friend of ACE. We call it the FACE network itself. So it's a multi-pronged approach to reach out to all of our migrant workers who need help. I'm actually happy to go deeper into the details itself, perhaps if we have time. But I think given the amount of PQs that we have to cover today, I will leave it as that and hope it answers your question.
Leader of Opposition.
Just one supplementary question for Minister. Minister, you spoke about the pilot which saw an increase in numbers from 500 to 3,000. Can Minister share with the House what were the considerations that determined that number 3,000? Why not 2,000 or 4,000? Because that will give at least the public and those who are looking at this issue more closely some idea as to when further opening can potentially take place, or at the very least when certain foreign workers who may need a little bit more assistance can actually be attended to by the relevant agencies and individuals.
I thank Mr. Singh for his question. Indeed, Mr. Singh, the question of easing the restrictions for our migrant workers to go out into the community is constantly on our minds. Not just all of us in MOM, particularly the ACE team. They are also really at the back of, not at the back, but right on an almost daily basis itself, we contemplate. When we first started, in fact, we planned for the easing of the restrictions since as early as December last year. This was about a month after we formed the Dawn Task Force. At different times, when we planned with the draw plans that we have in place, each time we were hit by different curveballs. I think you would have read about the Delta variant, and at any particular point in time when we tried to ramp up easing the restrictions itself, there were new turns of and significant turn of events that did not allow us to do so. So we then focused on a singular approach of ensuring that all of our migrant workers are protected through vaccination. So the vaccination centers were set up, and our focus was really making sure that they were protected. When we were able to bring them up to a high level of vaccination within the dorms, again, we tried to work on a mechanism for easing. And I think that in my earlier interview with the Straits Times and with the media itself, I said the key thing was finding a safe and a very calibrated manner. And I think that there were obviously subsequent events that have overtaken us. But in spite of that, once we've achieved that high level of vaccination, and we also had enough evidence to show that those of us who have received and completed the 2 doses of the vaccination, the incidence of complications was significantly less than those who were unvaccinated. So with that, we took on that pilot in mid-September to allow that 500 to go up. Now, we also sought feedback through our survey with the migrant workers to ask them what would it be important for them when they go out to visit these community areas. And many of them wanted to go to a religious place of worship. So our ACE team then engaged the Hindu temples, the mosques, as well as churches to see how they could accommodate them to fulfill their religious needs. And of course, we also work with the shopkeepers and so on. So we identified shopkeepers, the retail shops to make sure that social distancing was adequately maintained. We reached out to the churches, the temples, the mosques to get them to support us, and we started that pilot visit. We also had to ensure, because of the fact that as we move towards endemicity, at some point we were also concerned about, given the space that they are living in, to ensure that the infection, if it comes into the dorms itself, doesn't spread. So we took all the necessary precautions in terms of pre-event testing before they left, and after coming back, we also tested them. When we were able to ascertain that entire visit was safe, we were able to adequately address their physical, mental, social needs. On top of that, keep them medically well protected. We then ramped up from 500, increasing it 6-fold to 3,000. And we also increased the area. Now, at each step of the way, there were quite a fair bit of logistic arrangements that we have to make, including arranging for the buses to bring them there, also making sure that the itinerary, the programs planned for them, they were adequate. And in the beginning, we even had to nudge employers because even though we opened up 500 a week, we found that for a while, we were only getting about 50-60% of them coming on board. And there were also migrant workers who signed up only to cancel at the last minute. So these are all these logistic issues and so on that we had to plan through. And once we were able to smoothen out all of these different gaps and so on, we then move on to increasing that number to 3,000. Now the plan, hopefully in the ensuing weeks and months ahead, is that as we move to this new normal, the plan is not to restrict but to open up even more. But at this particular point in time, because we just started the 3,000, I think last weekend, just about 3 days ago, we will maintain and watch it for a while. I hope that answers your questions.